Good evening, everyone. I'm going to give it about 60 more seconds to see if anybody else jumps in, and then we'll go ahead and get started. All right. So good evening, everyone. Thank you for joining us. You have joined us for part 2 of a 4-part Medicare 101 series. And tonight we're going to be talking about Medicare Supplements, also known as Medigaps, and Medicare Advantage plans, also known as Medicare Part D. If anyone is having any problems hearing me, please let me know. You can either type it into the chat box or try and unmute and just simply speak up. Hopefully everybody got the email this evening with the handouts for today's presentation, as well as the slides for you to follow along with. We've got a lot of information to cover, but I will pause at different points of the presentation for an opportunity to ask questions. You can ask your question at any time during the presentation by simply typing it into the chat box. Or when I pause to take questions, you're welcome to simply unmute yourself and I will take your question live. So it looks like there's nobody else coming in, so we'll go ahead and get started. So hello, my name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am with the SHIP program, the State Health Insurance Assistance Program. And this is Medicare 101 Part 2, Medigap and Medicare Advantage plans. Again, I am part of the Area Agency on Aging for the Pikes Peak region, and the purpose of the Area Agency on Aging is to work with our communities in a 3-county area to coordinate and develop systems and programs that help people stay in the community for as long as possible. As part of the SHIP program, I am the coordinator for the SHIP program. The SHIP program, again, that's State Health Insurance Assistance Program, is a federally funded program that's designed to provide free and unbiased in-depth counseling, one-on-one counseling on all things Medicare. So we can help you with education information regarding all parts of Medicare, all Medicare insurance options such as Advantage plans, prescription coverage, supplements, employer plans, that kind of thing. We can help with applying for assistance programs for people who have limited or low income. The SHIP program within the Area Agency on Aging serves 9 counties in Colorado, and I've listed them on the slide. Every county in every state in the country has access to a SHIP program, at the very least through a toll-free statewide number, and I've listed Colorado's toll-free number on the slide as well. Just a quick review of last week's presentation. We reviewed enrollment and eligibility and benefits for Medicare Part A and B. So we talked about Medicare being free for most people as long as you paid into the tax system, covers inpatient services with some deductibles and co-insurances, and then Medicare Part B, which everybody has to pay a premium for, covers all your outpatient services. It also has an annual deductible and co-insurances. Again, Medicare A and B are considered your original Medicare benefits. And then just a quick update for Part B covered services. Last week I mentioned that Part B covers the annual vaccines, including the shingles vaccine. But there is a caveat to that. Part B covers the administration of the vaccine, and Medicare Part D, as in drug, covers the actual medication itself that's injected or administered to you. Again, tonight, we're going to talk about Medicare Supplements, also known as Medigap. So Medicare Supplement and Medigap are two terms that are interchangeable, two terms for the same thing. And then we're also going to talk about Medicare Advantage plans, also sometimes referred to as Medicare Part C. Both of these kinds of coverages are available to anybody who is currently enrolled in both A and B of Original Medicare. Both of these kinds of insurances, even though they're offered by private insurers, are regulated by Medicare, but there can be limited enrollment periods in which to get them. We're going to talk about Medicare Supplements first, or Medigaps. Because Medicare Supplements and Medicare Advantage plans are two entirely different kinds of insurance, we're going to talk in depth about both kinds of insurance, but we are again going to start with supplements. So what is a Medicare Supplement or Medigap? A Medicare Supplement policy is a health insurance policy that is sold by a private insurance company. It is designed to follow all federal and state laws that are there to protect you. When you purchase a Medicare Supplement policy, it must say Medicare Supplement Insurance, those three words in that order, in order for it to be a legitimate policy. The term Medigap comes from the thought process that it covers the gaps in your original Medicare benefits coverage, such as covering your deductibles and coinsurances. And Medicare supplements or Medigaps are standardized, meaning there is a limited number of levels of coverage for you to choose from. They're labeled A through N, like the alphabet, with the 3 states listed on the slide having some additional options in addition to the A through N benefits most of the rest of us have. Costs do vary from company to company with Medicare supplements. It can vary by plan. It obviously can vary by company. It can vary by your zip code. It can vary by your age. It can vary by the fact that you smoke or you don't smoke. So there's a lot of different calculations that go into premiums for Medicare supplements. And it does pay to shop around. So again, Medicare supplements work with original Medicare only. So when you are looking at Medicare supplements, that means you are going to have your original A and B of Medicare as your primary coverage, and a Medicare supplement is going to be your secondary coverage. So they're going to pay after Medicare pays first. There are some situations where you would need both A and B of Medicare, your original Medicare benefits. So in order to purchase a Medicare supplement, you'd have to have enrollment in A and B. Some situations where you wouldn't need or want to purchase a supplement or Medigap, if you're already enrolled in a Medicare Advantage plan, you cannot purchase a supplement in addition to that. You can only have a supplement or an Advantage plan. You can't have both. Or if you have other credible coverage, such as TRICARE for life, if you're retired military, if you have the option of health insurance that coordinates with Medicare through your employer or previous employer as a retirement benefit. So for example, if you are a para-retiree or a federal civil service retiree, I know both of those entities offer really good Medicare coordinating health benefits for their retirees. In this situation where original Medicare is primary and the supplement is secondary, because original Medicare is primary, original Medicare is good anywhere in this country for any medical necessity with any provider that will accept it. And as long as a provider will accept your original Medicare and original Medicare pays for that service, wherever you're at in the United States and or our territories, as long as Medicare pays their part, a supplement will pay the balance. That is what it's designed for. So Medicare supplement is a private policy you purchase from a private insurance, but is solely and specifically designed to pay the balance or supplement the balance that Medicare left over as long as Medicare paid first. So let me repeat that real quick. Medicare supplements are private policies you purchase from private insurance companies, and they are solely and specifically designed to pick up the balance that Medicare Part A and Medicare Part B left over after they paid their part first, period. And that's all a supplement does, is it pays that balance as long as Medicare paid their part first. On the flip side of that coin, if Medicare doesn't pay anything for a service, the supplement doesn't pay anything either. So it's only there to pick up the balance after Medicare pays first. So who can have a supplement? Well, again, as long as you have original Medicare A and B as your primary coverage, you are eligible to purchase a Medicare supplement or Medigap policy. However, there are specific timeframes that might be better to do that than others. The first one is going to be a guarantee issue period, or basically any timeframes are going to involve some sort of guarantee issue. So if you are in your guarantee issue period, that is obviously going to be the best time to purchase a Medicare supplement because you will be guaranteed issue into that kind of insurance. But you can purchase a Medicare supplement at any time. There is no annual enrollment period for supplements. There is no open enrollment period for supplements. Medicare gives you a guarantee issue period when you first become eligible for Medicare, and then there may be additional special enrollment periods where you might be guaranteed into a supplement sometime in the future based on a special scenario. Otherwise, if you are healthy and you can pass underwriting, and what underwriting means is an insurance company is allowed to ask you health-related questions. And if you answer those questions and they don't like your answers, that's underwriting. So they get to ask you medical questions. If they don't like the answers, you have too many health issues, they do not have to sell you insurance outside of these guarantee issue periods that we're going to talk about. So a guarantee issue period means that they cannot turn you down based on any pre-existing health concern. But if you are healthy and you can pass underwriting, you can purchase a Medicare supplement at any time in the future as long as you're healthy enough to pass underwriting. Guarantee issue periods may be especially important for people who are under 65. The state of Colorado does have a law that requires that insurance companies that sell Medicare supplements must offer a guarantee issue period for people who become eligible for Medicare who are under 65. If someone's becoming eligible for Medicare who is under 65, that's typically because they've been determined to be disabled by Social Security, which means there's likely to be some sort of health issue already, a pre-existing health concern. Without the laws in Colorado specifically, if that person who becomes eligible for Medicare and is under 65 tries to buy a supplement, the supplement would not sell them coverage because they are on Social Security disability for some reason. But again, in Colorado, Colorado requires that these insurance companies provide that person a period of guarantee issue so that they can purchase that kind of coverage when they first become eligible for Medicare. If for some reason the person who is trying to purchase that supplement under 65 finds that that cost of that insurance is too expensive, which it can be because they may not be able to turn someone who's on Medicare disability away from buying coverage, but there's nothing that says they can't charge more in premiums. So if anybody who is under 65 wants a supplement but can't afford it, keep in mind that you would also get an additional period of guarantee issue when you turn 65 or age into Medicare. It'd be like starting all over. And so you'd get another period of guarantee issue, another opportunity to buy this kind of coverage, and it would be at a much lower premium. So obviously, again, that's going to be the best time to purchase a Medicare supplement is during that guarantee issue period. When is that guarantee issue period? Well, it's going to be based on your initial eligibility into Medicare. Your eligibility and enrollment into Medicare, both A and B. So it's also referred to as an open enrollment period for Medicare supplements. Your guarantee issue period is a 6-month window that starts the first day your Medicare A and B are both in effect. So as soon as both A and B of Medicare are in effect, your 6-month clock starts ticking. And that 6-month clock means you can purchase a Medicare supplement from any company of your choice, any level of coverage that you want, and no company can turn you down for any reason whatsoever. This guarantee issue period can be especially important for anybody who does have any sort of pre-existing condition, health condition. simply because of that underwriting. So outside of a guarantee issue period, or once a guarantee issue period expires, once that 6 month expires, and you want to try and change to a Medicare supplement or change to a different Medicare supplement, you would be subject to underwriting, meaning at that point, the insurance company can ask you health questions again, and they would have the ability to deny you coverage based on the healthcare answers. So again, for people who may have some pre-existing health concerns, this guarantee issue period could be especially important. And once that 6 month window, once that clock starts ticking, it can't be stopped. So once you get a 6 month period of guarantee issue, and once it's gone, it's gone. The only other time you might be able to have guarantee issue into this kind of coverage outside of this initial 6 month guarantee issue period would be under a special enrollment period. Special enrollment periods are going to involve some sort of loss of coverage, some sort of involuntary loss of coverage primarily. Excuse me. So if you say you are on Medicare and you had a health retirement benefit from your past employer that was coordinating with Medicare, and so you had original Medicare as your primary coverage, you had your retirement benefit as your secondary coverage, everything was working wonderfully. And then all of a sudden you got notice that your previous employer was no longer going to offer retirement health benefits to you or any of their other retirees. That would be considered an involuntary loss of other credible coverage. So because you had coverage as a retirement benefit through your past employer, that coverage is considered credible, meaning it's an adequate excuse for not getting this kind of coverage when you first had an opportunity. But when you lose that coverage involuntarily, it does create an opportunity for you to have another guarantee issue period into a Medicare supplement, excuse me. Same would go if you are continuing to be employed. So if you are still actively employed and you have insurance coverage through that employment, and it covers you and or your spouse, and you become eligible for Medicare, but you continue to work, whether you enroll in Medicare during your employment or not, when that employment ends, that becomes a special opportunity for you to be able to enroll in a supplement with guarantee issue. Now, under special enrollment periods, special opportunities to enroll in supplements, you only get a limited amount of time, so you don't get the full 6 months usually, depending on the situation. So if you voluntarily lose coverage, you get a 60-day window, but if it's involuntary coverage, Colorado does provide a full 6 month window above and beyond your initial 6 months of guarantee issue when you first become eligible for Medicare. The other most common way that someone might get an additional opportunity to have guarantee issue into a Medicare supplement is through an Advantage Plan test drive. And we're going to talk about that test drive in more detail when we get to the next part of this presentation about Advantage Plans. Things that Medicare supplements do not pay for are going to be the same kinds of things that Medicare doesn't pay for. So it does not cover anything that would be considered long-term care or custodial care, does not cover dental or vision benefit, hearing aids, private duty nurses, homemaker services. Obviously, it's not going to cover outpatient prescription drugs because, again, that will fall under Medicare Part D as in drug. Again, the whole point of a Medicare supplement is that it picks up the balance that Medicare A and or Medicare Part B left over after they paid their part first for any service that you needed. And again, if Medicare denies payment for any service that you received, the supplement will also deny payment. It's not designed to pick up whatever Medicare left or left over or didn't pay for, it's designed to pick up what Medicare left over. So if Medicare denies, the supplement denies. As I mentioned previously, Medicare supplements are available in about 10 levels of coverage. These 10 levels of coverage are standardized. What that means is the 10 levels of coverage that are outlined on this chart here are pretty much set in stone. So every company that's licensed to sell this kind of insurance in Colorado or any state, so this is a nationwide standardization. Any company that sells a Medicare supplement has to sell the plans that are outlined on this chart. Now they can pick and choose which plans they want to sell, but whatever plans they choose to sell, they can only sell them as they are outlined on this chart here. They cannot add to any of these plan choices. They cannot subtract any benefits from these plan choices. These levels of coverage are set in stone. So if you are looking to purchase a plan G is a plan G is a plan G, no matter who you buy it from or what they want to charge you. It's the exact same coverage from everybody. So as I mentioned, these plans are labeled A through N like the alphabet. Under each plan level or plan letter designation, so for example, in this first column, we have Plan A Medicare Supplement, Plan B Supplement, Plan C, Plan D, etc. Don't get these plan levels confused with your Medicare parts. So there's Medicare Part A and Part B and Part D. These are supplement plans. Plan A, Plan B, and so forth that go with your Medicare Part A and Part B. All plans across the board are going to cover what's considered basic benefits. So Plan A, Medicare Supplement Level Plan A, covers only basic benefits. But basic benefits in a nutshell, it pays the 20% Medicare leftover for Part B services after Medicare pays their 80% first. So Medicare Supplement Plan A only covers that 20% for Part B services after Medicare pays first. Does not pay any Medicare deductibles, just the 20% leftover for Part B services. If we look at Plan B Medicare Supplement, it covers that basic benefit of 20% for outpatient services. It also covers your Part A inpatient hospital deductible every time you're admitted to the hospital. But that's all it covers is those two benefits. I'm going to skip over to Plan D, which covers basic benefits, the 20% for Part B services. It covers skilled nursing coinsurance. And if you remember from last week, the skilled nursing coinsurance, Medicare pays the first 20 days for any skilled facility care. And then starting on day 21, they start applying a coinsurance of $185.50 per day. Plan D and higher will pay that $185.50 per day, starting at day 21 for any skilled facility stay. Again, Plan D also covers Part A inpatient hospital deductible every time you're admitted. And it also includes this benefit down here, foreign travel emergency. There are several plans that do include that foreign travel emergency benefit. Keep in mind that I actually shouldn't be calling it a benefit because it really isn't a benefit. It's a reimbursement. So quickly, let me explain how this foreign travel emergency clause works with these plans. So if you're going to be in a foreign country, you're traveling abroad, if you have a medical emergency while you're in a foreign country, basically you're going to pay for that medical emergency while it's happening. But once you get home from that trip, from being in a foreign country, you can submit the paperwork, the bills, the receipts from that medical emergency to your supplement. They're going to turn around and tell you to submit it to Medicare so that Medicare gets you a denial saying Medicare is not going to pay because you were in a foreign country. Once you get the Medicare denial, you submit that with your medical receipts from that medical emergency in a foreign country, and your supplement will reimburse you up to 80% of the cost of that medical emergency after a $250 deductible. So again, it's not something that's going to help you during the medical emergency in a foreign country, but it can reimburse a significant amount of that cost for that emergency when you get home. So again, it's a reimbursement and not an actual health benefit. When it comes to Medicare supplements, what I would suggest to people is that as long as you are looking at a plan that includes at least these first three benefits: basic, skilled facility, and Part A deductible. As long as you purchase a supplement level of coverage that includes at least those three benefits, you will have adequate coverage. You will be getting your money's worth. As we continue to go up this chart, again, I'm going to skip over Plan F and go to Plan G. Plan G, you're going to find, is probably one of the more cost-effective options to choose from. It's going to be very popular to purchase, and it is currently considered basically the Cadillac of Medicare supplement plans. Again, it covers those first three basic benefits: Part B, basic benefits, skilled facility coinsurance, Part A deductible, has that foreign travel emergency clause, but it also covers what's called Part B excess. To explain Part B excess real quick, there are basically two ways a provider can accept original Medicare. When you have original Medicare A and B, and you go to your provider, say your primary doctor, your doctor either accepts Medicare Assignment or he does not accept Medicare Assignment. And basically the way Medicare Assignment works is like this. Say you go to your doctor for just a regular office visit, and that doctor would normally charge someone without insurance $300 cash for an office visit. So that's going to be his base rate is $300. But you have Medicare. So when you go for your office visit, that doctor is going to bill Medicare his base rate of $300. Medicare is going to turn around when they get that claim, and they're going to say, for this type of office visit, we only allow or we assign $100. Medicare pays 80% of what they assign for a service. Your supplement under basic benefits would pay the other 20% of that $100. The doctor would get paid a total of $100. Because that doctor accepts assignment, he accepts that $100 total as payment in full. So even though he billed Medicare $300, he basically knew he was only going to be allowed to collect $100, and he was okay with that. He had to write off the other $200 of the $300 that he billed as if it never existed. When a provider does not accept assignment, it kind of works the same way. You go to your provider for an appointment. That provider bills Medicare $300 for that service. Medicare still turns around and limits or assigns the reimbursement for that service to $100 and pays 80% of that. The supplement, if you have one, will pay the other 20% of that $100. But because this doctor does not accept Medicare assignment, that doctor is allowed to charge you, the patient, 15% above and beyond what Medicare assigns for his services. So that doctor is going to charge you when you walk in that door or before you leave that office. That doctor is going to charge you $115. Because he does not accept assignment, he is required to bill Medicare for you, but Medicare is going to see that he doesn't accept assignment and assume that you paid that doctor at the day of service. They're going to assume that you paid him $115 before you left the office. And so when Medicare gets that claim and they process that $100 and pay 80% of it, they're going to send you a check for $80. Your supplement, again, under basic benefits, is going to do the same thing and send you a check for the other $20 of that $100. If you have a supplement that includes Part B excess benefit, it would also pay that extra 15% you paid up front. So it's also going to pay that extra $15 you paid that doctor. So you would get reimbursed everything that you paid at the time of service. Now, are there a lot of doctors out there that don't take assignment and then would make you pay up front? Not really, not in Colorado, but that may vary from state to state. So I can't say for any other state, I can just say for Colorado, it is not very common, but there are providers even in Colorado Springs that do not accept assignment. Again, these doctors are still bound to Medicare and to follow all Medicare rules and guidelines. They're still required by law to bill Medicare for you, but they are allowed to ask you to pay at the time of service, and they're going to collect a little bit more than they would collect if they took assignment. We go beyond Plan G to K, L, and M, and you'll notice that these plans, K and L in particular, cover the basic benefits for outpatient services only at 50 or 75%. They cover that skilled facility coinsurance at 50 or 75%. They cover the Part A inpatient hospital deductible at 50 or 75%. Because these plans in particular cover fewer benefits or lesser benefits than the other plans that we just looked at, their premiums are going to be much smaller. And they do have maximum out-of-pocket limits, meaning because they're only paying half of what Medicare left over, the half that you still have to pay goes towards that limit. And if you reach that limit or hit that limit before the end of the year, then that plan would have to start paying 100% until the end of the year. Plan M is kind of a hybrid. It pays 100% under basic benefits. It pays 100% of the skilled facility coinsurance, but it only pays half of the hospital deductible. And then Plan N, the last option, is kind of a hybrid as well. It does pay 100% for basic benefits, except for two services: office visits of any sort or emergency room visits. For those two specific services, you would have to pay a copay, a flat $20 for office visit, or a flat $50 copay for an ER visit. Otherwise, that plan pays 100% after Medicare for all other outpatient services. It pays 100% for skilled facility coinsurance, and it pays 100% for Part A deductible. Again, because this plan pays a little bit less than some of the other options, the premiums can be lower. And that's a lot to talk about, but those are your levels of coverage to choose from. These are the levels of coverage you have to pick from as Medicare Supplement. And so if you're looking at this kind of coverage, I always encourage people to pick the plan that gives them the best coverage for the long haul. So pick the level of coverage that you think is going to be adequate for you for the next 20 or 30 or 40 years. Because again, once you're enrolled in a Medicare Supplement, you're good to go. These plans, these insurance policies are guaranteed renewable. They cannot drop your coverage for any reason other than non-premium payment. So you're guaranteed to have this coverage for life as long as you pay the premium. But if you ever drop it, or if you ever try to switch from one company to another or one plan to another even within the same company, you could be subject to underwriting. And unfortunately, as life has taught us, the older we get, the less healthy we become typically, and the harder it might become to do that kind of switch or that kind of change. The reason I skipped over plans C and F, and that they're grayed out on this chart, and this chart was provided to you in the email of handouts that I sent you. Plans C and F are only levels of coverage that are available to people who were eligible for Medicare prior to 2020. So if you turned 65 in 2019, but you were continuing to be employed and you're just now going to start retirement and enroll in Medicare for the first time, you would have the option of purchasing a Plan C or Plan F because you were eligible for Medicare prior to 2020. But anybody who became eligible for Medicare after January 1st of 2020 no longer has the option to purchase a Plan C or a Plan F. The reason that is because you'll notice Plan C and Plan F cover Part B annual deductible. Oops. So they cover both the Part A deductible every time you're admitted to the hospital, and they cover that $200 and something Part B annual deductible. Those plans are no longer options for people who became eligible for Medicare after 2020, simply because the government decided that they were too good. It was considered first dollar health insurance coverage, and that was too good for us because basically it paid 100% after Medicare. We didn't have to pay anything but our premiums, and that was too good. It was too good a coverage. And so it's no longer an option, unfortunately. On the plus side, the benefit that has been taken away, that Part B deductible, is at this point still relatively small. Remember from last week, the Part B annual deductible for 2021 was only $203. So you pay the first $203 out of pocket, and then Medicare starts paying at 80/20. Okay, so that was a lot to take in. Are there any questions so far? Again, if you have a question, you can type it into the chat box, or you can simply unmute and ask your question. No questions at all. All right. If that is the case, then I will move on. And again, you can type questions into the chat box at any point and I will address them at the break. So also included in the email that I sent out earlier was the handout for Medicare Supplements. In the state of Colorado, we are very fortunate that our office at the Division of Insurance takes the time and the energy to put this document together. And I did what I emailed you was the more current document. This slide says 2020, but the document that I actually emailed you and for the handouts earlier today is for 2021. So it's the most current handout available. But this handout that the Division of Insurance puts together for us takes a lot of time, it takes a lot of energy, but what it tells us is it lists all the companies that are licensed to sell Medicare supplements in the state of Colorado. There are about 45 of them. It also tells you what plans each company sells, and it gives you an approximate monthly premium for each company's plan that it sells. So all the companies are listed in the handout in alphabetical order. The plans are laid out by age group. So each page is a different age group. Premiums do get higher the older we are when we purchase this kind of coverage. Premiums do go up every year with this kind of coverage, just like with any other kind of insurance. The premiums shown on this handout are going to be approximate. They're going to be ballpark. They're not going to be specific premium quotes. They're going to give you an idea of what each company charges for each plan that they sell so that you can compare them to all the other companies that sell that same plan. So it's not going to tell you exactly what you're going to pay, but it's going to give you an idea of what the companies charge. If you wanted an exact price quote, you would have to call the company directly. But for comparison purposes, because you can kind of see what companies charge for what plans, you can see that there are some companies that charge really, really high premiums for one plan and other companies that charge really low premiums for the same plan. So if you'll notice, all the companies are listed along the side here. Again, they're going to be in alphabetical order. It's going to include their toll-free number. And then it's going to have that A through N across the top here. If you intersect company X with column G, which represents Plan G supplement, if there's a number where those two meet, that represents an approximate monthly premium for that plan with that company. You'll notice that every company sells a Plan G, so all the boxes are filled in this column. And you can go down this column and kind of compare apples to apples to see what companies charge less and what companies charge more for that plan. Keep in mind, a Plan G is a Plan G is a Plan G, no matter who you buy it from. A Plan G is exactly as it is outlined on this chart. Companies cannot alter these plan levels in any way. So they're all selling you the exact same product, the exact same thing. but there will be variances in the pricing from company to company. Does that mean a company's better if they charge more? No. Does it mean a company is worse if they charge less? No. It just means it pays to shop around. Some companies will come in at a lower premium because they have a larger share of the market. They have more people enrolled, so they can afford to have lower premiums. Other companies may not. Again, there are a lot of variables that go into how insurance companies determine premiums. Quite frankly, I don't want to have any idea how they do that. I know it's a long, complicated, convoluted formula that they use. I don't want to know. But what I can tell you is it pays to shop around. It pays to compare apples to apples and find a plan that's going to be cost effective and cost competitive. And this is the whole point of this handout, is going to let you go through the list of all these companies licensed in Colorado so that you can narrow down the handful of companies that you might want to explore further or might want to make contact with to get an exact price quote. So again, this is designed to give you an idea of what prices look like, what companies charge less and what companies charge more, and it gives you a place to start. All right, so again, that's Medicare Supplements in a nutshell. I'm gonna ask one more time if there are any questions about any of that information so far. Okay, I've got a couple of questions in the chat box that I will address real quick. First question is, will VA coverage act as a gap plan or as a Medigap? Unfortunately, it does not. So VA benefits or VA coverage assistance is very siloed. So VA does not typically coordinate with Medicare, and Medicare typically does not coordinate with VA. VA will cover services for you for VA related needs. Medicare will cover services for you for any needs, but they will not coordinate with each other. So it does not act as a Medigap, and you can't expect it to. So if you have copays through the VA, you still have to pay them. If you have original A and B and you get services in the community outside of the VA system and you don't have a gap plan, you will have to pay the balances Medicare left over. VA will not pick them up. And then the next question is, will gap insurance price change once signed up? Again, insurance is insurance, whether it's Medicare Supplement, whether it's Medicare itself, car insurance, home insurance. Insurance premiums don't tend to do anything ever but go up. And so the same theory applies with Medicare Supplements. The prices that you are quoted when you first become eligible for Medicare and get enrolled are going to be the lowest they're ever going to be, because you'll be in a preferred pricing status because you just became eligible for Medicare. But count on that premium increasing every year. How much? Typically 6 to 15% on average per year. That does not necessarily mean you may not have some years that are higher or some years that are lower, but 6 to 15% should be average. If you ever have a supplement and suddenly you get a premium increase that's like 40 or 50%, that's something that I would certainly question the legitimacy of, and perhaps even call the Division of Insurance to see if they've signed off on a plan increasing their premiums that much. Looks like I got another question. What does the CR, AC, et cetera in column 2 stand for? So these little letter designations stand for how the plan rates itself, whether it's community rated, attained age rated, issue age rated. So that's going to be the CR, the AA, the AI. What that means is that is how these insurance companies determine how they're going to raise premiums. So if an insurance company says they're community rated, what that means is they basically should be charging the same premium for everybody who turns 65 in a given year and lives in a specific zip code. Everybody should be paying the same price for a plan. And when premium increases come around, it'll be the same increase for everybody. If a company is attained age rated, that means they will have a premium increase based specifically on the fact that you attain a certain age or an age group. And then there's issue age rated, which means a company will base a premium increase on the fact that you had a birthday, basically. So they charge us a specific premium based on the age when it's issued. And then every birthday, your anniversary for that policy will basically ensure a premium increase. Other designations are whether or not there's a application fee, whether or not it has a pre-existing condition clause, that kind of stuff. The key to these letter designations in column 2 are on the page previous to this page in the actual handout that I sent you. So there is a key code for those letter designations in the actual handout. So hopefully that answers that question. All right. So we will go ahead and move on. And now we're going to talk about Medicare Advantage plans. Okay, Medicare Advantage plans are an entirely different animal. They're an entirely different kind of coverage than Medicare Supplements. For people who enroll in Medicare Advantage plans, these plans are offered by private insurance companies, just like supplements, but these companies contract directly with Medicare, where supplements do not. So these are private insurance companies that contract directly with Medicare. And what that contract means is that company has agreed to act as Medicare on Medicare's behalf. So basically, these companies contract and agree to provide whatever benefits Medicare, original Medicare offers through that insurance company, that private insurance company. So basically, they become your Medicare when you enroll in these plans. When you enroll in a supplement or a Medicare Advantage plan, you still have original Medicare A and B. You still have to pay your Medicare Part B premium, always. But while you're enrolled in an Advantage plan, that plan becomes your Medicare. Medicare pays that plan to act as Medicare on Medicare's behalf. So any benefit that original Medicare would have paid for, once you're enrolled in an Advantage plan, it becomes that Advantage plan's responsibility to pay for. Enrolling in a Medicare Advantage plan, you are still guaranteed all the rights and protections of original Medicare. You are still able to access any and all benefits of original Medicare. However, they're called Advantage plans for a reason. And you may be able to get some additional benefits above and beyond what original Medicare offers through an Advantage plan. These extra benefits could include some basic vision, hearing, dental, free gym memberships. As time has gone on, these Advantage plans are starting to include more and more extra benefits that original Medicare does not cover. Most Advantage plans do come with Medicare Part D at no extra cost. When you have original Medicare and a Medicare supplement, supplements do not include drug coverage. You would have to buy a Part D plan in addition to original Medicare and your supplement. With Advantage plans, typically the Part D coverage comes included in the package at no extra cost. Not always, but mostly. There are some additional eligibility requirements to enroll in an Advantage plan. The most important one is that you have to live in that plan's service area. So when you enroll in a Medicare Advantage plan, you are enrolling in a plan that's available for purchase in the county you reside in. Typically, if that plan has a network that you are required to stay within, that network is going to be the county you reside in. If you live in Teller County, you cannot purchase a plan that's for sale in El Paso County and vice versa. Again, you must be enrolled in both A and B of Medicare, and you do have to pay your Part B premium. And you can only enroll in these kinds of plans during an annual enrollment period. So Medicare Advantage plans do have an annual opportunity to get into them, to get out of them, or to switch from one Advantage plan to another. So your first opportunity to enroll in a Medicare Advantage plan is going to obviously be when you first become eligible for Medicare, which is going to be the same 7-month window that you have to enroll in Medicare. So it's going to be the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months past the month of your 65th birthday. That is your initial opportunity to enroll in an Advantage plan, keeping in mind that that plan cannot be effective any sooner than when your Medicare A and B go into effect. And then, of course, there is the annual election period, or what we consider open enrollment, which actually starts tomorrow for people who are already in Medicare. So if you're just becoming eligible for Medicare, or you're going to be eligible in the next couple of months, this annual open enrollment period that starts tomorrow does not apply to you. You do not have to worry about it. You do not have to think about it. You do not have to talk about it. It does not apply to you this year because you are not currently enrolled in Medicare yet, or you're just becoming enrolled in Medicare. Next year, once you are in Medicare, you may want to pay attention to the annual enrollment period, but this year you would not have to because you're going to fall under your initial enrollment period instead. But there is annual open enrollment period. Again, starts October 15th, runs through December 7th every year. Specifically for Advantage plans, there is an additional annual enrollment period, which runs from January 1st to March 31st each year. And then there are always special enrollment periods when it comes to Medicare coverages for situations that are beyond your control, basically. And we will talk about these each a little bit. So again, the annual election period, or what we call open enrollment, starts tomorrow, October 15th, runs through December 7th every year. During this time frame, if you are currently on Medicare, this gives you an opportunity to get into, get out of, or switch from one to another Medicare Advantage plan or Medicare standalone drug plan. And again, we're going to talk about drugs next month or next week. We're going to talk about Part D. So it gives you a chance to get into, out of, or switch from one Advantage plan to another, one prescription drug plan to another, or allows you to get out of Advantage plans and go back to original Medicare. Any changes you make during this October 15th through December 7th window doesn't go into effect until January 1st of next year. Again, if you are in a Medicare Advantage plan already, or if you are in a Medicare Advantage plan as of January 1st of next year or any year thereafter, you get an additional 3-month open enrollment period where you have an opportunity to switch from the Advantage plan that you're in to a different one. Or you can get out of the Advantage plan you're in completely and go back to original Medicare and buy a standalone drug plan. If you are not enrolled in an Advantage plan as of January 1st, this enrollment period does not apply to you either. So you cannot do anything during this time frame unless you are currently enrolled in an Advantage plan as of January 1st. Special enrollment periods are pretty common with Advantage plans. As I mentioned earlier, when you are enrolling in an Advantage plan, you have to enroll in a plan that's available for purchase in the county you live in. If for some reason you move out of that county, so say you move from Colorado Springs to Denver, you cannot take the Advantage plan with you because it's only good in El Paso County. So when you move out of the service area or county of residence, and you cannot take that with you, it is considered an involuntary loss of coverage. Based on that involuntary loss of coverage, because that is not your fault, you can't take it with you, you would have a special enrollment period to either have guarantee issue into a Medicare supplement based on that involuntary loss of coverage, or you would have a special opportunity to enroll in a different Advantage plan if one is available in the county that you move to. But again, anytime you have an involuntary loss of coverage for any reason with a Medicare-related insurance product, Medicare will provide you a special enrollment into something else. And then I talked about test drive. So Medicare Advantage plans can be a little confusing. Not that Medicare itself is not, or Medicare Supplements are not, but Medicare Advantage plans can be even more confusing. And that is simply because they are becoming much more prevalent. I know many of you have probably seen the multitude of commercials on every channel every day of the year for Medicare Advantage plans, whether it's Joe Namath or JJ Walker or that redneck comic guy. Someone is always trying to sell you a Medicare Advantage plan on TV. And they make them sound like there are all kinds of benefits that Medicare doesn't typically pay for, but you can get through in a Medicare Advantage plan, which can be possible, but isn't entirely accurate. There are more and more Advantage plans to choose from every year. So for 2022, we have just learned that there will be over 54 Advantage plans to choose from in Colorado. That's a lot of different plans to choose from. So these plans get a little more confusing every year. Medicare has decided to provide people with a test drive opportunity. What that means is they're going to give you up to 12 months to enroll in an Advantage plan and test drive it to see if you like it, to see if that's the kind of coverage that's going to work for you for the long haul, for the next 20 or 30 or 40 years. If at any point within that first 12 months test drive, you decide this isn't the kind of coverage for you, you'd much rather have something else like a supplement, it gives you an opportunity to drop that Advantage plan and still have guarantee issue into a supplement. There are two ways you can use this test drive. You can either enroll in an Advantage plan as soon as you enroll in Medicare and just try it out from the get-go. Again, you would have up to 12 months to test it out. And if at any time within that 12-month period, you decided you didn't like it, you didn't want it, you wanted to drop it and go to a supplement instead, you would be allowed to do so with guarantee issue into the supplement. The other way you could use this test drive is if you become eligible and enrolled in Medicare and you enroll in a supplement from the get-go and you maintain that enrollment in a supplement without any breaking coverage, and say 2 or 3 or 4 years down the road, you decide you're going to try an Advantage plan during open enrollment. And so you enroll in an Advantage plan during that annual open enrollment period, you drop your supplement, you get 12 months to test drive that Advantage plan. If for any reason during that 12-month test drive, you decide it's not for you, you want your supplement back, you're guaranteed back into the supplement you dropped when you dropped it to test drive the Advantage plan. Those are the only two ways you can use a test drive, and they only apply to people who are 65 and older. So it's a special enrollment period only for people 65 and older. But it can extend your opportunity to have guarantee issue into a supplement. And it gives you the ability to try out Advantage plans without risking your ability to have guarantee issue into a supplement. So keep that in mind. If these are plans that you're curious about, if you're interested in trying out, you can test drive them for up to a year to see if they're the kind of coverage that will work for you. Again, with Medicare Advantage plans, you still have to pay your Part B premium, always. Now, I know there's some advertising out there that says you can get that Part B premium back. Technically, that's true. There are some plans out there. There are very limited plans in Colorado that offer that benefit. And none of them that I know of offer full reimbursement of your Part B premium. But that's exactly what it is reimbursement. You still have to pay the premium. If you can find a plan in your area that offers some sort of Part B reimbursement, then you can enroll in that plan and get some reimbursement. But again, very few plans offer that in Colorado, and it's going to be in very limited counties. So not even every county will have a plan that offers that. And it is reimbursement. It's not going to pay your premium. It's going to reimburse you some of your premium. Medicare Advantage plans may have a monthly premium in addition to paying the Part B, although there are many, many plans in Colorado that have 0 monthly premium. So as long as you're paying Part B, you may not have any additional monthly premium to enroll in an Advantage plan. On the flip side of that coin, you will have an out-of-pocket cost for most every service you receive that would be covered by Medicare while you're enrolled in an Advantage plan. So you pay little or no out-of-pocket in premiums, but you will pay out-of-pocket costs for services received. And typically those are going to be copays that you pay at the time of service. Again, these plans must cover any and all services that original Medicare would cover. So they can't say we're not going to pay for this if original Medicare would have paid for it. Again, most of these plans will include a prescription drug benefit, a Part D benefit, no extra cost. But you could be limited to what facilities and what providers you can go to based on what providers these plans contract with. These plans are typically going to be good in a service area. Depending on the type of plan, you may be limited to just service area of the county you reside in. Or you could be, you could be given the ability to get services anywhere in the country, as long as you can find someone willing to accept your plan. And of course, in an emergency situation, regardless of whatever kind of Advantage plan you may have, if you have a medical emergency anywhere in the country, that plan would have to cover you in a medical emergency. There are several different kinds of Advantage plans, and we're going to talk about the most common briefly. But HMOs, PPOs, private fee-for-service plans, special needs plans, and PACE plans are the most common in Colorado. If you want a complete listing of all the different types of plans and a list of all the plans offered in Colorado, the best way to get that list is through the Medicare New Handbook. You can call 1-800-MEDICARE and request that they mail you a Colorado-specific Medicare New Handbook. You might be able to go onto the Medicare.gov website, but I don't know that their PDF version of the Medicare New Handbook is state-specific. I do know the paper version is always going to be state-specific. Or you can use the Medicare.gov website's plan finder, basically their search engine function, and look at all the plans available based on a zip code. Other types of Medicare Advantage plans that are primarily not available at this point, Medicare savings accounts. No company offers them in Colorado at this time. Medicare cost plans, which we do still have in Colorado, but they are being sunsetted, which means they're being phased out by Medicare. We don't currently have any demonstration or pilot programs for Medicare in Colorado, but we do have PACE programs, and we're going to touch on each kind of plan briefly. So Medicare HMOs, Advantage plans are going to be the most common. An HMO is an HMO is an HMO. So if anybody has ever been in an HMO through an employer or what have you, you understand that if you're in an HMO, you are limited to using only those plans providers, contracted providers and facilities. You must stay within that network of contracted providers and facilities. You're not allowed to receive services out of that network of contracted providers and facilities. If you go out of network, that plan pays nothing. As long as you stay in network, you pay a copay for services. You may be required to get prior authorization for some services. You will likely be required to get referrals to see some types of providers. But again, in an emergency situation, it doesn't matter where you're at or what you need, that plan would have to pay for your emergency. HMOs will typically always come with Part D coverage. Medicare PPO Advantage plans are a little more flexible. These kinds of plans have a network of providers and facilities that they have contracted with. And as long as you stay within that network of contracted providers and facilities, you will pay a lower copay, but you're not limited to staying in that network. You are allowed to go out of network and see any provider that you want, as long as that provider is willing to accept your PPO Advantage plan. However, that plan will still determine what you have to pay in copays, and that copay will be higher when you go out of network. But because you're allowed to go out of network, referrals are not required. However, you may still be required to have prior authorization for some services. PPOs may or may not include Part D coverage. If you enroll in a PPO that does not include a Part D benefit, you would not be allowed to purchase Part D separately. So you would have to have a good reason to enroll in a PPO without drug coverage, such as you use the VA's drug pharmacy instead, which would be acceptable. Private fee-for-service Advantage plans were intended to be the most flexible. They have no network of contracted providers or facilities. You're able to go to any provider anywhere in this country for anything you need. But again, that's as long as you can find a provider willing to accept your plan and whatever the plan decides to pay them. On the other side, if you find a provider willing to accept that plan, because that provider is not contracted with that plan, that provider can decide to treat you one day, but refuse to see you the next day. There's nothing that says they have to continue to see you if they decide on a whim they don't want to anymore. So they can make that decision on a day-to-day basis because there's no contract saying that they have to treat you. And again, you become responsible for making sure you can find a provider willing to accept your plan and that plan's payment. But again, there's no network, no referrals required. Prior authorizations may or may not be required depending on the plan. These plans may or may not come with Part D included. However, if you get a private fee-for-service that doesn't include Part D, you would be allowed to buy a separate Part D plan to have drug coverage. Special needs plans are basically going to be Medicare Advantage HMOs, but for very specific populations, typically for people who are Medicare and full Medicaid, or for people who live in long-term facilities, or for people who have qualifying chronic health conditions. These are basically going to be HMOs. They're not available in all areas or all counties. Cost plans, again, I'm not really going to talk about because they're being sunsetted and phased out by Medicare. PACE programs we do have in Colorado. Again, limited service area, so they're not available in all counties. They're primarily going to be available in the more urban areas of Colorado, basically up and down the I-25 corridor. PACE programs are basically going to be HMO Advantage plans, but for, again, specific populations. So the population served by a PACE program are going to be people who are eligible for Medicare and long-term full Medicaid. This plan is designed to help people stay in the community versus having to go into a long-term care facility. If anybody wants any additional information about any of these plans, you're always welcome to call us and we can certainly provide you with more information. You do have rights, the same rights you have with any Medicare coverage, but specifically to Medicare Advantage plans. Your rights are that you have the right to have access to the healthcare providers you need. You do have the right to know how your providers are paid by the plan. You have the right to fair, efficient, and timely appeal processes, and even expedited appeal processes in some circumstances. You always have the right to get the healthcare services you need. You have the right to get information about your plan and those services in easy to understand language. And you always have the right, of course, to have your personal medical information kept private. Any of those rights are violated, I certainly would encourage you to report that to 1-800-MEDICARE. So again, there's a lot of advertising for these kinds of plans. There's a lot of marketing for these kinds of plans. I just want to point out a couple of things that are and are not allowed by people who represent these kinds of plans. So there are many things that people who are marketing or selling these kinds of insurance policies are not allowed to do. Things they're not allowed to do are approach you in common areas. So an insurance agent or salesperson is not allowed to come up to you in the grocery store, in a parking lot, in a lobby and just start talking to you about whatever they're selling. They're not allowed to do that. They're not allowed to go door to door. They're not allowed to send you unsolicited texts or cold call you to market their products. They are allowed to send you emails, just like any other kind of junk mail that you may get. And they are allowed to send you junk mail through the actual postal service. These companies, these plans are not allowed to just use terms like free to describe their coverages that have zero premium. They're not allowed to require that you provide contact information if you're going to attend a sales event. So if you have agreed to go and listen to someone tell you about Humana Healthcare Advantage plans, when you go to that event, they're not allowed to require that you give them your name and contact information. They're not allowed to require that you sign in at all in order to attend that event. So they can't require your contact information. They cannot camp out in doctors' offices, basically, period. Doctors should not be promoting specific plans or companies typically, and they should not be allowing agents into their lobbies or their waiting rooms in order to try and sell you coverage. They are also not allowed to misrepresent themselves to you. So they're not allowed to say, I'm with Medicare or Medicare approved or anything like that. So they can't misrepresent. Medicare does not endorse specific companies or products. They endorse everything that they allow, but they don't endorse specific companies. Typically, if someone is going to offer, say a Kaiser agent is going to offer a presentation like this, an educational presentation. If you go to an educational presentation where they're just going to tell you about Medicare in general, as soon as you walk out of that presentation, they can market to you whatever insurance that they sell. So if a Kaiser agent is doing an educational presentation, they cannot tell you specifically about Kaiser products during that presentation because it's for education. They're supposed to be giving you general Medicare information. But as soon as you walk out of that presentation, they can have a table set up and try and sell you the Kaiser products that they represent. In the past, that had not been allowed. It would have had to have been two separate presentations at two separate locations and two separate times. But these days, as soon as you walk out of an educational presentation, you can be marketed to. They're not allowed to provide or pay for dinner for you for marketing purposes. And they're not allowed to go door to door. And that includes leaving flyers at doors or on door handles. I have had calls where agents have gotten into secure senior apartment complexes. And before you know it, they've gone to everybody's door and at least left a flyer or slipped something under the door. That is so not allowed. Any of these activities that you witness or that you feel might be happening, I would strongly encourage you to contact us and let us know so that we can report that to Medicare. You're always welcome to call 1-800-MEDICARE to report that activity. Or you can also call the Colorado fraud hotline and report that activity, and I'll provide that contact information at the end. There are some things these plans are required to do. These plans are required to submit all their marketing material to Medicare for approval before they offer it to the public. They must comply with do not call lists. They must get permission from you to contact you in writing by completing what's called a scope of appointment. And basically what that means is they have to fill out a form that says you have agreed to meet with them at this day, at this time, to talk about this specific product. And when you meet with them for that specific appointment, all they can talk to you about is that specific product. They cannot try and sell you or talk to you about anything other than what you've agreed to talk to them about. So if you're going to meet with an agent to talk to them about the Advantage plan that they're selling, during that meeting, they cannot talk to you about other types of coverage, such as supplements or annuities or anything like that. They would have to fill out an additional scope of appointment form and and set another appointment in order to talk to you about any additional products. Okay, so again, that's a lot of information to swallow in a very short amount of time. For people who are considering Medicare Advantage plans, there are a few things that you need to ask yourself and the plan that you are looking at. So that means you need to ask these questions of the representative for whatever plan you're looking at or getting more information for, or any of the plans, all of the plans that you may be getting more information from. Primarily, first and foremost, and I can't stress this enough, if a plan includes a drug benefit, please make sure your drugs are covered by that plan. We're going to talk about this in more detail next week, but every single individual plan out there has a slightly different list of drugs that they cover. And you want to make sure that your specific drugs are covered on any of these plans' specific lists. So you can't just assume because a plan includes drug coverage that your drugs are covered by that plan. You want to make sure and make them look them up. If you have primary care providers currently that you want to keep, you don't want to have to change your providers. I would encourage you strongly to talk to your current providers to see if they take Advantage plans, and if so, which ones. If you don't do that and you enroll in an Advantage plan and you find out after the fact that your doctor doesn't participate with that plan, you're going to have to change doctors. If you have a hospital preference, a hospital network preference, in Colorado Springs, we have two primary networks, Memorial and Penrose, or whatever they call themselves these days. If you prefer one over the other, make sure you ask that plan if they participate at one or the other or both. If you see a lot of doctors or if you see specialists, make sure you know whether or not that plan is going to require you get a referral before you see your specialists, because that could involve you having to go to two medical appointments, your primary for the referral and the specialist every time you want to see that specialist. And those are just a handful of questions you want to ask. Think of anything else that might be of importance to you when it comes to your health coverage, and be sure to ask those questions. If you don't ask those questions, you don't get those answers, you may be in for some unfortunate surprises when that plan goes into effect. Again, this is one of the handouts that I included in the email I sent earlier. This is also put out by the Division of Insurance, and it basically gives you some basic information about the different types of plans, gives you some pros and cons. So basically goes over the same things that I've kind of gone over with you today. I've also included a handout that puts together a list of all of the Advantage plans available in El Paso County. This slide says 2020, but we do actually have a 2021, which as of tomorrow is probably obsolete for those who are looking at open enrollment. I am working on updating it for 2022, and I hope to have that available to hand out to people by Monday. So if anybody is interested in getting this snapshot of the Advantage plan specifically for El Paso County only, I'm happy to provide that to you. I'll simply ask you to email me and request it, and I'll be happy to send it to you as soon as I'm done with it. But basically, this is just going to give you a one-page snapshot of all the plans that are available in El Paso County for 2022. Gives you their names, tells you if they're HMO, PPO, gives you some examples of common costs such as premiums, deductibles, primary visit copays, etc. So it kind of gives you an at a glance side-by-side comparison of some of the more common costs with all of the Advantage plans available here. And again, I hope to have the one available for 2022 ready by Monday. So let me know if you would like a copy of that. All right, so that is Medicare Advantage plans. Are there any questions about any of that? Again, you can type your question into the chat box, or you're welcome to simply unmute and ask your question. All right, I do have one question in the chat. Is there a medical review to join an Advantage plan? All right, so that again is going to be another big difference between supplements and Advantage plans. Medicare Advantage plans are never allowed to look at health history. So they cannot ask you health questions. They will not ask you health questions. They cannot turn you down for any reason whatsoever, ever. So you're guaranteed to have enrollment into an Advantage plan any year during open enrollment. You can switch to an Advantage plan during open enrollment every year. You can change that plan with no questions asked. So there's never any medical questions or medical underwriting with Advantage plans. So hopefully that answers that question. Any other questions? All right.
Hey, Roma, it looked like there was, I see a couple more in the chat. One is from Cheryl. What does CR, AC, et cetera, in column 2 stand for?
Okay, so I did address that question at the end of the last. And again, that key code for those abbreviations are going to be in the previous page of that original actual handout that I emailed to everybody prior to the presentation.
Perfect, thank you.
Mm-hmm. All right, you guys are awful quiet. But of course, you guys are always welcome to email me with any questions that you think of after the presentation. I'm always available by email, or you're always welcome to call our office and talk to one of our counselors at any time. So if there's no other questions, we will move on and wrap it up. So Medicare does offer, or the federal government basically does offer, some financial assistance for people who have limited or low income, called Medicare savings programs. Medicare savings programs can help with paying your Medicare Part B premium primarily. So if you are eligible, you apply for and are approved for Medicare savings programs, then what that is going to provide you is the state of Colorado will pay your Part B premium so that Social Security does not deduct it directly from your Social Security check. So that could at the very least save someone $148.50 this year. For financial assistance programs, there are income and eligibility guidelines and limits. I've listed the limits for 2021 on this slide. If anybody would like any additional information about these programs, we do help with applications for these programs, and we're happy to help answer any questions or help with an application, or help even just determine whether or not you might be eligible. All right. So again, that is pretty much all we got for tonight. Our office does do is the S&P program for our 9 counties as well. This is the Colorado Fraud Hotline. Anytime you may witness or are not sure whether or not someone is marketing appropriately or may be doing some of those cannot things, again, you're welcome to call 1-800-Medicare. You're welcome to call our office directly, or you can call the statewide toll-free hotline and report that activity. And again, if you have any questions, concerns, or want more information, or want help during open enrollment, we are booking appointments left and right now to help people through open enrollment who are already on Medicare. Keep in mind that if you're just becoming eligible for Medicare, you do not have to worry about open enrollment that starts tomorrow. But again, we're always happy to answer any questions that you may have. You can email me at seniorinsure@ppacg.org. You can call us at our local Colorado Springs number, 635-4891. You can call us through our toll-free statewide number. And we're happy to either schedule an appointment or speak with you over the phone. We are still currently not encouraging in-person appointments at this time. And that is it. So unless there are any other last minute questions, I will let you guys go and enjoy the rest of your evening and catch up on the football game. But again, please let me know if there's anything else that we can help you with, or if you have any questions, just shoot me an email. Otherwise, hopefully I will see you all next week for part 3 of our 4-part series when we discuss in depth Medicare Part D coverage. So barring no other questions, thank you all for attending. Have a good night and we'll see you next week. Thanks.